Hi everybody, welcome. This is Dr.Surindher, your friendly neighborhood plastic surgeon. So today we're just going to briefly talk about why I don't do fillers anymore for the nasolabial folds. So fillers are basically used when you have volume loss. And when you have a volume loss, you're going to, as we age, we tend to lose volume in the fat pockets, so that is the deeper pockets as well as the superficial pockets. Along with that, there is loss of collagen tissue, and then that causes the tissues to sag or the faces to sag, and that is what causes this deep nasolabial folds. Studies have shown when they have dissected cadavers and then checked out that this area, that is the inner part of the fold, is where actually you increase the fat, or as you age the fat there increases, whereas you lose fat in the remaining areas. So for me, when you mentally think about it, for me it doesn't make sense to increase this bulk when it's already bulky. You're gaining fat here, so there is already a bulk, and then you're going to be increasing more bulk here. It doesn't make sense. What you actually need is for the face to be lifted back. The tissues need to be lifted back to where it should be, and then you have to correct the volume loss. So you can see, if you can pull one side and bring it back to how it should be, then you can see that the lines are reduced significantly, and that is what happens. And when you look at the OG curve on the side, you can see that this needs to be lifted up to where it should be, and that is what needs to be done. So just including a filler here is not going to solve the purpose. That is why I've stopped doing fillers for the nasolabials. For the nasolabials, actually what you need is a lift, which could either be a thread lift in faces like Southeast Asian faces, which are heavier, which needs a thread lift, or if it's a Caucasian face, then you can go in for a regular facelift, which will tighten your skin, tighten the muscles, and of course along with that we also do tighten the snatch, and along with that we also do volume replacement, which is basically with the fat grafting, and we replace the fat that is lost. So that should give you a much better result and a much more long lasting result, rather than doing just fillers here, which are again temporary. When we talk about threads, the flip side of it is I'm not talking about the cork threads. Cork threads are basically the Korean threads that you see nowadays with the hooks and all over the range over the internet. But they are fixed from the skin to the skin. So you don't have a fixed point, because the skin is also mobile and this is also mobile. So there is a skin to skin fixation which doesn't last very long. What we talk about when we talk about thread lifts is to do a suspended thread lift, which is basically to suspend it from the muscle around here, and then it comes down to the face and it pulls it up, and it is fixed here. Since it is there, it is fixed to a certain point or a fixed rigid structure, the results last longer, though the downtime is more. Initially we overcorrect it for you to see that the face is pulled back, so you have a downtime of about a week, which needs to be corrected, and once that is done, then you can actually readjust it in a week's time, and then that should last you about 3 to 4 years, after which you can always add a few more threads. And then yes, we do need to, because aging is constant and your volume loss in the face and everything might be constant, so yes, you might have to do a touch up later on as the time goes by. Another reason is the fillers will last you only about 6 months to a year. Thread lifts might last you 3 to 4 years, and then if you need added threads, then you can always add. So that is why I've stopped doing fillers for the nasolabials, and I would rather do a lift and bring things back to how they were, rather than doing a filler which is going to add to bulk, which is already a bulky area.